Intestinal ultrasound is an ultrasound across the abdomen. It's painless, gentle, takes about 10 or 15 minutes to do. And this is your actual IBD provider showing you in real time what they're seeing. And it's not like any other test where you get the test done and you wait hours or days to find out the results. We use these really high-def machines where we're measuring the wall thickness of the intestine down to millimeters. And just the difference of a millimeter or two can be that this looks healthy or this looks inflamed. We can scan your colon all the way around your abdomen and even see often the connection point between the small intestine and the large intestine, and really pinpoint not only do you have inflammation, but where is that inflammation. Colonoscopy is the gold standard for making a diagnosis of inflammatory bowel disease. And we're careful to say that intestinal ultrasound does not replace colonoscopy. It's a different kind of information that we get, but it may reduce the number of colonoscopies that someone has over their lifetime. I think significantly reduce that number. And we're learning about, are there situations where a normal ultrasound might be enough and you might not need a normal colonoscopy to back that up?